All right, dexamethasone, its common trade name is Decadron. It is a corticosteroid, and an adrenal glucocorticoid is kind of the class that it's in. It's a steroid. Mechanism of action: suppresses inflammation and the immune system, and it is pregnancy class C. Some stuff that we can use it for: asthma, croup, anaphylaxis, and then we can also use it in spinal cord injuries and increased ICP and use it to decrease that inflammation with those injuries. Something we don't want to use it for is sepsis, and it has immunosuppressive properties, and so we don't want to suppress the immune system in anybody who we think might be septic. Adverse reactions: usually there's none with single dose. We want to avoid long-term use, and because it can lead to hyperglycemia, edema, swelling, some GI bleeding, ulcers, nausea, vomiting, hypertension, euphoria, and headaches. So usually, especially in the emergency setting, we just give one dose, so not a big deal. Some drug interactions we want to avoid with metaraminol, and then calcium. Try to use different lines, different IVs, stuff like that. Dosage: 10 to 100 milligrams IV or IO push, or 1 milligram per kilogram IV bolus over time. With the kids, usually 0.25 to 1 milligram per kilogram is our standard dose for that. It's not a fast onset type thing. This takes several hours to start working. Peak effects are seen in 8 to 12 hours, and then it stays in the body for a couple of days usually. Really, the only special consideration we want to look at is avoiding long-term use with it, just to prevent those adverse reactions that we discussed a minute ago.